This is Dr. Seacrest, and if you're watching this video, that probably means that you just decided to move forward with a hip or knee replacement with me. If you're watching this video and you're still trying to decide whether or not a hip replacement or a knee replacement is right for you, you may find some of this information useful in educating you for that decision. But my goal in this video series is to equip patients who are going to go through this process with as much relevant knowledge as I possibly can, so that there's no surprises along the way and we can minimize the amount of anxiety that you're feeling about this. So to those patients, the first thing I would like to say to you is thank you. It means the world to me that you would trust me with your health, that you would trust me with your hip or knee, and it's a responsibility I take incredibly seriously. I want you to have the best outcome I possibly can, and I think that this is a huge component of that. I want you to be fully educated about what this involves, what you can expect, and what you can do to maximize your chances of having a good outcome. The reason that I've chosen to make these videos is that studies have shown that after meeting a doctor and having a medical visit with a doctor, patients typically remember about 15% of what was said. And I hope that by providing this reference, it's something that you can refer back to when you're uncertain about things in the future, or potentially watch more than once so that we can increase that above 15% and you can feel like you know exactly what's coming your way. This video series is the product of years of work. I have been working on this for a very, very long time, and it's something that I anticipate I will continue to work on in the future as well. So as my practice evolves, I'll revisit this video and change it so that I can ensure it provides you with the most up-to-date information possible about what we're going to do for you. You may find that that means that throughout this video I suddenly get older, and that's just a reflection of the evolution of my practice over time. This can be viewed on a phone or on a computer. However, you may find that it's best to watch it on a computer because there are graphics and graphs and other visual aids interwoven throughout the video that you may find are best to view on a larger screen. Again, from the bottom of my heart, thank you for trusting me. I want to do the best that I can for you, and I think that the most important way we can ensure that happens is that I equip you with the knowledge you need to have a good outcome. Now, far and away, the most important question about a partial knee replacement is, after you've had the surgery and made a complete recovery, will you be glad that you went through it in the first place? And this is something that's been studied exhaustively. In this study, about 90% of patients were satisfied following a partial knee replacement, and about 5% of them were dissatisfied. While this sounds very encouraging, it still means that about 1 in 10 people will regret going through this surgery. And I think that's important to bear in mind as we move forward and prepare for it. Now, why would I choose to lead with that at the very start of this video, talking right at the beginning about how there's a possibility you might regret having this done? It's because I think the most important thing you can do psychologically to prepare for surgery is to have a goal. We are not going to put back in what was in your hip or knee when you were 20. We're going to put back in metal and plastic that will function very similar, but it's not the same thing that you were born with. You still will have mild irritations related to your artificial joint. And if you are basing this entirely on whether or not you notice it throughout the day, you may find that long term you can still tell that you had an artificial joint. However, if there's something that you can't do right now because of your pain, and you regain the ability to do that after working with exercises following the surgery, then I think that's what equips people to say, yeah, this was worth it. I couldn't garden. I couldn't get on my boat. I couldn't go for a hike. I couldn't ride a bike, whatever it is for you personally. And afterwards, when you regain that ability, that's what allows you to say, oh, absolutely, this was worth it. I got something back that matters to me, and now I'm in a better place than I was before. So that's why it's so important to me that we have goals that are realistic and that we're working towards together as we work through this recovery. Now, if we've decided to do a partial knee, one of the questions you're probably asking yourself, and probably also asking me during our clinic visit, is why not just do the whole thing? Why leave parts of the knee behind when I'm already in there? And the reason is demonstrated by the graph that you can see on my right. On this graph, higher scores are better knee outcomes. And this is patients telling us how they're doing with their knee. The dashed line is where patients were before surgery. And you can see that the blue line, which is a total knee, and the red line, which is a partial knee, both result in more patients being further to the right or better on this graph. However, there are more patients in the partial knee group, the red line, who are doing fantastic than there are total knee patients. And what this means is the best outcome of a partial knee is better than the best outcome of a total knee. So if by preserving your lateral compartment and your patellofemoral compartment, we can allow you to have most of a normal knee while replacing just the medial compartment, that will allow us to preserve the possibility that you have the best outcome possible. Another benefit of a partial knee relative to a total knee is a faster recovery. In this study here, you can see on the right that the partial knees were doing better than the total knees at every time point following surgery. Now, I'm much more concerned about the long-term outcome of the surgery than I am about the short-term outcome of the surgery, but this is a nice added benefit. Now, there is a trade-off for the improved outcomes that we see with partial knees, and that's an increased risk of needing additional surgery on the knee. This has been borne out in multiple studies and is a very repeatable finding. You can see here from the American Joint Replacement Registry the risk of needing a revision for a total knee relative to the risk of needing a revision for a partial knee. The partial knee is clearly higher. Now, there are a few things that may make this a little bit difficult to interpret. The biggest one being that it's easier to convert a partial knee to a total knee than it is to revise a total knee. So in some cases, dissatisfied patients may have ended up having that conversion, which they wouldn't have had if they had had a total knee in place because it's such a big surgery to do a revision on a total knee. So it's hard to interpret, but the data is clear. If you have a partial knee replacement, you are at higher risk of additional surgery than if you had had a total knee replacement. But let's talk about what we can do to mitigate that risk. Now, there is a trade-off for the improved outcomes that we see with partial knees, and that's an increased risk of needing additional surgery on the knee. This has been borne out in multiple studies and is a very repeatable finding. You can see here from the American Joint Replacement Registry the risk of needing a revision for a total knee relative to the risk of needing a revision for a partial knee. The partial knee is clearly higher. Now, there are a few things that may make this a little bit difficult to interpret. The biggest one being that it's easier to convert a partial knee to a total knee than it is to revise a total knee. So in some cases, dissatisfied patients may have ended up having that conversion, which they wouldn't have had if they had had a total knee in place because it's such a big surgery to do a revision on a total knee. So it's hard to interpret, but the data is clear. If you have a partial knee replacement, you are at higher risk of additional surgery than if you had had a total knee replacement. But let's talk about what we can do to mitigate that risk. Now, the number one thing we can do to make sure that you don't eventually have your partial knee converted to a total knee is avoid burying our heads in the sand and pretending that there's not arthritis in the lateral compartment or the patellofemoral compartment when there is. And this is why I generally get an MRI before I'll do a partial knee. I want to make sure that if I'm putting in a partial knee, I'm doing it so that that will be the only surgery you'll ever need. I'm not doing this as a temporizing procedure, planning down the road to convert it to a total knee after the rest of the knee wears out. And additionally, when I perform the surgery, I use special tools to make sure that I keep the stress of the knee on the portion that wore out in the first place so that we're not transferring your weight over to the portion of the knee that we're trying to save. And that's something we'll talk about later when I talk about how I actually do the surgery. The other important aspect of making sure that you don't wear out the other portions of your knee and go on to need a conversion to a total knee is to make sure that we don't put the stress of the knee onto those portions of the knee when we do the partial knee. And this is on me. And in order to make sure that I don't do that to you during your partial knee, I use robotic assistance. This allows me to make sure before I start making my cuts that your knee will continue to be stressed through the portion that was already worn out, the portion that I'm replacing. This helps me be confident that I'm giving you a partial knee that's going to be your only knee replacement you need long term. I'm not doing this as a temporizing surgery. I don't want it to just last for a while. I want this to be the only knee replacement that you ever need. Now, I think that the robot is a really useful tool for helping me avoid pushing you from stressing one portion of the knee to stressing the other portion of the knee. And there may be some benefit long term, but as you can see here in this study to the right, it's very hard to assess that from a data perspective. However, I feel confident that with that tool, I can better guarantee that I'm going to keep you in the alignment you came into the operating room with. There are a few things about a partial knee that can be mildly irritating long term, and I think it's important to hear these on the front end so they don't surprise you on the back end. The first is that you'll be left with a small numb patch on the outside of your knee. This is because the nerves run from medial to lateral in the skin and are cut during the incision. Number two, you will find that the knee is slightly bigger than the other side. As the scar tissue forms after the surgery, it makes it look somewhat puffy. Number three, you will probably not want to kneel on this knee. This is just something that we see. It's not a restriction that we tell people they can't kneel on it. It's just that most people find it uncomfortable and don't want to. And then number four, you'll still have mild aches and pains from time to time in this knee. We replace the cartilage on the ends of the bone, however, we leave behind all the tendons, ligaments, joint capsule, and other soft tissues around the knee that make up the rest of the knee. These things can still have aches and pains from time to time, so it's important to remember that this is not going to be the knee that you had when you were 20. It's a metal and plastic substitute that functions very similar to the knee, but it's not exactly the same. The most obvious thing that we can do to optimize your health before surgery is check on your medical condition. This is why on the day that we booked the surgery, we ordered labs and an EKG. Depending on those results, we may ask you to do certain things before your surgery, and in some cases may even delay your surgery while we work to optimize your health. If you have a primary care provider you see on a regular basis, we want you to go see them and make sure that there's nothing they would recommend you do before your surgery to ensure that you're in the best health possible when that surgery occurs. If you see specialists, we want to know who they are and what you see them for. It may require us coordinating with those specialists depending on what you're seeing them for. And finally, we want to know all of the medications that you take on a regular basis. Some of these medications may need to be modified around the time of surgery, and it's important for us to know everything that you're on. It's obviously always important to eat a healthy diet, but it's especially important as we prepare for your surgery. We need you to be able to heal following the surgery well. And in order to do this, you need to have good nutrition. Here you can see the myplate.gov recommendations for what should be on your plate during a normal meal: fruits, grains, vegetables, and protein. In addition to this, I will actually check your labs for two nutritional factors that I think are particularly important. One of them is vitamin D, and the other is albumin, which measures the amount of protein in your blood. All of us out here in the foggy Northwest run a little bit low on vitamin D, so it may be a good idea to supplement this no matter what. However, if you're particularly low, I will prescribe you a prescription level of vitamin D. Additionally, if I find that there's not much protein in your blood, we need that for you to be able to heal the wound following surgery. So I would recommend then using some form of low sugar protein supplementation. Here you can see two examples of what that might be. The key here though is I don't want you to get too much sugar in your system as you're working to add in more protein. One thing that may seem a little bit counterintuitive to talk about optimizing before we move forward with a knee or hip replacement is your psychological health. But we want to optimize this too. Arthritis hurts. And when it hurts, it keeps you from doing the things that matter to you. That's probably why you're doing this in the first place. Unfortunately, that inactivity actually makes your arthritis worse. And this can make your pain worse too. Additionally, missing out on those activities that matter to you is in and of itself challenging. And in some patients, not all, but some, this can actually lead to clinical depression. Now, the obvious response to that is, well, if I could get myself to stop hurting, then I wouldn't be depressed. However, this isn't always the case, and sometimes that clinical depression extends past the period of time when you've recovered from your surgery. We can think about this like somebody who's lost a spouse. If you were going through the grieving process for your spouse and you began experiencing symptoms of clinical depression, we would still treat you for that. And it's no different with arthritis. If this is the causative factor that led you to end up feeling depressed, we still want to treat you for that. And it's particularly important if we're going to move forward with surgery because that allows us to break up the cycle of inactivity and pain and allow you to psychologically be ready to fully engage with your recovery and move forward from there and hopefully have a good outcome. I want you to be as strong as possible after you've had your joint replacement so that once your arthritic joint stops hurting, you're able to get to work and enjoy the lack of pain. However, this requires striking a really delicate balance between your pain prior to surgery and your ability to exercise prior to surgery. Because we know the only way you're going to build up that strength is by doing some form of exercise. However, it hurts, and that's why you're getting the joint replacement in the first place. So we can kind of think of this like a pyramid, and the higher up the pyramid, the more strenuous the exercise is going to be and the more beneficial. However, we're going to have to dial it back depending on the level of pain that you're having. So at the very top of the pyramid is running. You're probably not doing a lot of running if you're about to have a joint replacement. You're probably not doing a lot of hiking either. If you can walk, that's great, but actually biking or an elliptical will be easier than going for a walk in most cases because you don't have the impact of your foot on the ground driving through your arthritic joint. And then we can get into even lower strenuous exercises, which in some cases are all that you may be able to do as you prepare for your joint replacement. But whatever you are able to do, I want you to do it to make sure that you're equipped to drive through your recovery after we've done the surgery. Now, I know of a few areas in our community locally where you can find places that will accommodate your decreased mobility as you're working to do some form of exercise in preparation for your surgery. I've listed them over here on the right along with some phone numbers. If there are additional ones that you know of that you would like to see added to this list, please let me know so that I can let my other patients know where they can go to find some form of exercise while they're getting ready for their surgery and potentially afterwards as well. Obviously, surgery hurts. And there are things that we can do before the surgery to try to help you manage that after the surgery. Far and away, the biggest thing that you can do is if you are currently taking opioids, stop. Opioids before surgery will make your pain much worse after surgery because they actually hypersensitize you to pain. And you can get into a vicious cycle of accelerating and increasing doses of opioids just to have the same level of pain control when you take them chronically. Well, if you go through a big surgery and the amount of physical stimulus that is causing you pain goes up, we see the exact same thing. You've already completely saturated all of your opioid receptors, and it's almost impossible in that situation after a surgery to get your pain under control. So I would really strongly recommend that if you are currently taking opioids, you stop completely beforehand, even if that means you have to delay the surgery significantly, because the last thing I want to do is have you have pain after surgery that's out of control and not be able to help you. There are a few other things that we can do to optimize you for pain control after surgery as we're leading up to it. In my opinion, the biggest one is ice. I want you to have an ice machine that pumps cold water continuously to a pad that we can put directly on your surgical site. The reason is this is the one thing we can do that will numb you up right at the surgical site anytime you're hurting before or after surgery. There are a lot of things that I will do to try and take care of your pain after surgery from a medical perspective and things that I do during the surgery, and we'll cover those in later videos. But as you're getting ready for the surgery, I want you to get an ice machine and test it out. You're hurting right now from your arthritis. See how much of a difference this makes for that. And afterwards, you'll see the same difference for your post-surgical pain. Now, we offer one in our clinic that we can sell to you, but I'm also very sensitive to the budgetary constraints that some of my patients have. You don't have to buy it from us. It's available elsewhere, and there are other machines that function exactly the same. If you want to get something else, please go ahead and do so. But I really want you to bring one of these with you, and I will personally ensure that it is on your hip or knee before you wake up from anesthesia so that you're being iced before you even know that you've had surgery. Surprisingly, quality evidence for meditation as a way to control pain as well, including the pain associated with the surgery. There are numerous resources out there that will take you through a guided meditation or mindfulness session, and it's worth giving it a try. If this helps you to control your pain, it's much, much better than taking a medication, even if it may seem counterintuitive that it would work. On the screen here, I've got 2 apps that offer guided meditations and mindfulness. However, if you just punch in on YouTube, meditation for pain or mindfulness for pain, there are numerous resources out there for free as well. As we move forward from here, you'll hear from my staff regarding follow-up with your labs and scheduling the surgery. And you can also plan on receiving more of these videos from me with the information that I think is most relevant to you at different time points along the way as we prepare for your surgery and then work together to recover from it. I'll do my part to perform the best surgery I possibly can for you. I want you to do your part to ensure that you're in the best condition possible to realize that recovery. And if we work together, I think that we can achieve a good outcome for you.